Blood pressure, one of the very important parameters. In fact, I can say one of the vital measurement. We all know it's a number, but what is the unit of that number? Many do not know. I'm Dr. BALA'S. Today we will talk something about the units, how it is written, in what unit it is recorded. Well, all the organs need blood for their function and survival, and this depends upon a particular pressure. Only if the organ receives a adequate quantity, then only the organ can function. So don't you think blood pressure is very important to know something? You should know something about blood pressure, the basics of blood pressure. And as I told, when the blood pressure is less, the organs will not receive enough blood. Same time, when the blood pressure is more, the organs may get damaged. Blood pressure measurements are taken routinely in a clinic, and anyone with high blood pressure, suspected to have high blood pressure, will be measured again on each visit to confirm the blood pressure, whether it is a sustained increase in blood pressure, a sustained elevation, or a momentary elevation. That means what? We are not definite about the reading when we take once or twice in a clinic. We will not declare a person that he is a hypertensive or a increased blood pressure person unless we are very sure about the reading, because this reading is one thing which is highly variable depending upon various factors. And of course, that is why we have an increased use nowadays of home blood pressure monitoring and 24-hour monitoring of blood pressure. The patient goes with his daily routine to know the fluctuations in 24 hours so that we will come to a conclusion. That is because it is highly variable. Inaccuracies can arise from operator error, poor use of the equipment, and inadequate maintenance of the equipment. All these factors have to be taken into account when we come to a conclusion whether the person is having a high blood pressure or not. Measuring blood pressure is not always direct. It's not straightforward. It is usually measured indirectly from the pressure in a cuff placed around your limb, which stops the blood flow in an artery. This is the basis of taking a blood pressure. We give counter pressure to know the pressure exerted by the blood, which is pumped out of the heart. Blood pressure varies very much, and it may go up if the person is nervous, especially in a clinic setup with all the suffering people around him, and the doctor is new to him, and he has a fear whether what the doctor will say, whether he will say you have blood pressure or not. All these fear factors and anxiety will be there, and definitely anxiety is one of the reasons why the blood pressure may get raised. We do not give much importance to blood pressure as we give to diabetes mellitus. Why? Because many people do not talk about blood pressure even in the media, but everybody talks about diabetes mellitus. And everybody is afraid of the complications of diabetes mellitus, but not with the complication of hypertension or blood pressure, high blood pressure. But remember, this is a silent killer. Complications arise in diabetes mellitus slowly. In the course of years, many years it will take. But if a problem arises because of blood pressure, you call it an attack. It's an attack. A stroke is an attack. The infarction, the myocardial infarction, what you call heart attack, is attack only. So a little bit of knowledge we should have about high blood pressure or hypertension. But today I'm not going to talk much about the numbers, how it is elevated, what factors can affect this, and what can we do to reduce the blood pressure. Not like that. I'm going to talk about a basic thing. What is the number? How it is written? And what is the unit of blood pressure? Again, like blood sugar, this is also a number, a normal number, an elevated number. This number depends upon many factors, including your mood, sleep, and most of the time you go to the doctor with some complaints, some discomfort, and that discomfort itself may increase your blood pressure. Blood sugar test is done by an equipment, but blood pressure is taken mostly manually. An equipment very rarely causes mistakes, but human errors are very common. Again, many of the hospitals, the doctors do not take the blood pressure. Usually the nurses take the blood pressure. When a person is anxious, when the pulse rate is high, the amount of blood pumped out will be more, which is one of the reasons why you get increased blood pressure in a hospital setup. Come home, your blood pressure may be normal. So these are all the some of the factors which we will discuss later. So errors are more common with blood pressure taking, unlike blood sugar values. Like blood sugar, blood pressure also varies. Take all the factors into account before branding a person as a high blood pressure person or a hypertensive person. He will be taking medicines lifelong for something which he is not suffering from because of the wrong readings we take often due to many causes. So, so we have to think twice, thrice before committing that the person is having high blood pressure. That is why we never reveal the number at the first instance on a first reading. We always ask the person to come once or twice or thrice to confirm. What is a unit of measurement of blood pressure? What do they mean? The letters following the number. Now we have two numbers, and most of the people will talk which number is important, the first number or the second number. We shall see that later. Let us see the units of measurement and its meaning. How do we express the reading, and what is a unit of BP? Everything has got a unit. Weight you measure in grams or kilograms, whatever it may be. Length and breadth you measure in centimeter or feet, etc. But what is the unit of blood pressure? The reading is expressed as 120/80 millimeter of Hg. It is written as mm of Hg. What does that abbreviation mean? Remember, Hg is the chemical symbol for mercury, right? And mm, as you know well, yes, millimeter. It means 120/80 millimeter of mercury. So before that, before going into the what is the meaning of that mm of Hg and why that is mercury and why that Hg and all, let us see a little bit about the equipment with which we measure the blood pressure. The blood pressure apparatus, as you know well, sphygmomanometer. There is a glass tube about 1 foot height, the bottom of which has a reservoir, and this reservoir is filled with mercury. You can see in the picture. The tube is calibrated in millimeters, and we can see it. It is calibrated up to 300 millimeter, that means 30 centimeter, which is equal to 1 foot. So the height of the calibrated tube, glass tube, is 1 foot. This reservoir, which is filled with the mercury, is connected to a cuff by means of a rubber tube. The cuff can be inflated with the help of a bulb, a rubber bulb-like thing. When you press it, the cuff is inflated, the mercury column will rise. We tie the cuff around the arm, not loosely and not too much tightly, of a person who is going to have this blood pressure measured. Now we inflate the cuff, and because the cuff is connected with a mercury reservoir, the reservoir is connected to the vertical glass tube. This pressure increase due to the inflation of the cuff will raise the mercurial column from the reservoir into the vertical tube. By seeing the glass tube, which is calibrated, we can read and measure how much of pressure is needed to raise the column. That pressure which is needed to raise the column to 120 millimeter, for example, is taken as the pressure. That means when the blood is coming out of the heart by the pumping action of the heart, we are raising the pressure to 120 millimeter to stop the flow of blood in the blood vessel. This is the concept. Now, why mercury is used is a big question. And why not just water, which is easily available and all? The reason is mercury is a liquid metal, so it has more weight and denser than water. To be precise, to be exact, mercury is 13.6 times denser than water. So it occupies lesser space. That means lesser height in the tube. So 1 millimeter rise of mercury is equal to 13.6 millimeter rise of water. So if I want to fill it with water, for every millimeter of mercury rise, we have the water column will rise 13.6 millimeter. Just calculate for 1 millimeter is equal to 13.6 millimeter of water. Then the tube, the glass tube height will be more than 13 feet if I really want to fill it with water. Now we will know why mercury is used instead of water in this blood pressure apparatus. Again, the water will get evaporated, but mercury will not get evaporated. That is one thing. A blood pressure measurement of 140 millimeter, for example, literally means that the pressure will push up the column of mercury to 14 centimeters only. The tube is about 30 centimeter. So 1 millimeter of rise of mercury means 1 millimeter rise of the pressure. And now we are using aneroid blood pressure apparatus. The reason being mercury is a toxic substance, a hazardous substance. So people who are using it and people who are doing a repair work on blood pressure apparatus, they are exposed to the effect of mercury, the hazardous effect of mercury. So slowly the mercurial blood pressure apparatus, the sphygmomanometer, is slowly getting replaced with an aneroid or dial type of apparatus. But whatever apparatus we use, we always mention the blood pressure as millimeter of mercury, mm of Hg only. This is the gold standard, a manual measurement. Even though there may be errors, but we still use it. Even the aneroid blood pressure apparatus may have errors in it. Now hope you know the concept of measuring blood pressure. You know something about the apparatus, how it is calibrated, why we are using mercury instead of water, etc. So next time when you see your blood pressure written in your record, in your sheet or in your case sheet, you see what is written and in what unit is written. This is the concept behind measuring or taking a blood pressure reading and recording it. In my next video, we shall talk something about the numbers, what the number mean, and how they make it elevated. And very importantly, I will tell you Some of the factors which may affect the blood pressure reading. Many factors have to be taken into account before taking a blood pressure and before writing the blood pressure in a sheet. So today it may show 140 by 100 millimeter of mercury. Tomorrow it may show 120 millimeter by 80 millimeter of mercury. What will happen to the patient? So there are a lot of things to be considered when we take blood pressure reading. Otherwise, you will get a lot of false readings, and these false readings will definitely cause problem to the patient as well as to the doctor. We'll see what are the factors which will affect and what conditions to be fulfilled before taking a blood pressure. Can we see it in my next video? Till then, bye and thank you. See you again.